Go ahead, ma'am.
Good afternoon, everyone. My name is Dr. Sneha. I'm Senior IVF Consultant at Oasis Fertility, Pune. So we are here to discuss about an important topic related to fertility today, which is ovulatory dysfunction. So let's get to know first what does it mean by ovulation. So in a regular menstrual cycle, what happens is at least 14 to 15 days prior to your expected menses, there is a dominant follicle which forms and it reaches its maturity and it gets ruptured. This rupture of this dominant follicle is what is known as ovulation. So, ovulation is an important and critical step in a menstrual cycle of a female because this is the process which releases an egg which is thus available for fertilization and available for formation of the embryo, which leads to the pregnancy in turn. So, what does it mean by normal ovulation? So, normal ovulation is something in which one or two dominant follicles are formed in every cycle and they reach a mature size and they get ruptured on a regular time. This leads to release of the fertile egg and it also releases another hormone in the body which is known as progesterone. When the fertilization occurs, that is when pregnancy occurs, the progesterone keeps on maintaining this pregnancy. And in case the ovulation has happened, but fertilization, that means pregnancy has not happened, then the levels of progesterone hormone in your body, they'll fall, which leads to occurrence of menstruation, which we call as menstrual cycle. So when the ovulation is happening on a regular basis, it leads to a normal or regular menstrual cycle in which the periods are coming at fixed intervals with few days variation, and it leads to cyclical hormonal changes. So what do we mean by an ovulatory dysfunction? So ovulatory dysfunction is something where this normal process of ovulation isn't happening properly. Thus, there is absence of ovulation, or the ovulation happens, but it happens in an incomplete manner. Thereby, the release of egg is not complete, and this is a main feature that we find when a female is suffering from infertility or subfertility. So, what are the signs and symptoms that we encounter when there is something known as ovulation dysfunction? So, ovulation dysfunction, the first and foremost symptom would be the lady will be having irregular cycles. Of course, because there is no cyclical formation of a dominant follicle and the rupture is incomplete, thus, the levels of progesterone which are reached in the body are not sufficient enough to produce a regular cycle. So, irregular cycles is something that happens because of ovulation dysfunction. Another thing, of course, if the ovulation is not happening at the particular time, there is loss of synchronization between the egg growth and the growth of the endometrium. So the endometrium becomes out of phase and exceeds the ovulation, and thus, even if fertilization occurs, an effective implantation cannot happen. So this also results in another factor, that another symptom that we look for is infertility or subfertility. Then there is some conception like we assume that if a cycle is regular, the ovulation does happen. But sometimes this ovulation happens although it is incomplete. So it does not result into complete release of the egg from the follicle. If the egg is not completely released, again the egg is not available for fertilization and thus it leads to infertility and luteinized unruptured follicle. So even this is an ovulation dysfunction, but this is the type of ovulation dysfunction which occurs in a regular menstrual cycle also. So, what can be the causes of such an ovulation dysfunction? So, first and foremost, the cause of ovulation dysfunction is your hormones. So, there are various hormones in our bodies. First is the thyroid hormone, another is prolactin hormone, then another issues like diabetes, hypertension. many other things which are not related to reproduction per se, but then they also have such effect on your ovulation and can lead to ovulation dysfunction. The main cause that we nowadays encounter in ovulation dysfunction is PCOD or PCOS. So, this is polycystic ovarian disease in which there are multiple eggs or multiple follicles forming simultaneously, which compete within themselves to form a dominant follicle. Because of this competition, what forms is there is no recruitment or no selection of a dominant follicle, and thereby the hormone level that needs to be reached for an ovulation to occur effectively is not attained, and this will lead to ovulation dysfunction, and this is the most common cause of irregular cycles. Another thing is premature ovarian failure, where this is the opposite end of the spectrum, and the number of eggs that is available in every cycle is much less than what we require. So, in this scenario, the egg or the dominant follicle which is recruited does not have enough capacity or does not secrete hormone sufficient enough to cause an effective ovulation, and thus this will also lead to ovulatory dysfunction and infertility. There are many other things which we encounter in our day to day or routine lifestyle which induces stress. So, there are many stress hormones that also get released because of these factors, and these extraneous factors also lead to ovulation dysfunction. Another important cause is prevalence of some chronic illnesses or some disease that is apart from your reproductive function. Mainly, anemia is something that we encounter even now in our societies. So, chronic anemia or some chronic infection like tuberculosis, dietary insufficiencies, these are also some factors which can also contribute to your ovulation dysfunction and irregular menstrual cycles. So, how do we treat these factors, or what is the formula for treatment when an ovulation dysfunction is diagnosed? So, first of all, when ovulation dysfunction is diagnosed, when we analyze our cycles, if of course there are irregular cycles, it is very clear that the ovulation is probably not happening on time. Apart from that, if there are regular cycles, but in spite of that, the lady is not able to conceive, then there might be ovulation dysfunction in the presence of a normal menstrual cycle also. So, this is the population which we need to focus, or these are the women who should seek treatment to diagnose if there is any presence of ovulation dysfunction in them. So, how do we analyze this? So, when you go to your gynecologist, what happens is she'll ask you a few set of questions like, when was your menarche? That is, when did you, at what age did you have your first menses? What is your nutritional status? How is your lifestyle? What is the weight? What is the BMI? Do you have any underlying causes which can contribute to ovulation dysfunction and infertility? So, these are few sets of questions we ask in your history, which also guide us towards a diagnosis of ovulation dysfunction. Another thing, like even in presence of a regular cycle, how do we exclude whether the ovulation is happening on time or not? So there is something that we call as follicular monitoring. Follicular monitoring is when in every cycle we analyze how the growth of follicle or a dominant follicle is forming, how much days it's taking to form a dominant size, and whether the endometrium, that is the inner lining of the uterus, is growing in synchronization with this follicular growth. So, if these two things are happening hand in hand and they're progressing properly according to the days of your menstrual cycle, then this will exclude your ovulation dysfunction. After an ovulation happens, there is supposed to be a sufficient rise in your hormone, which is known as progesterone. And it is this progesterone which determines whether the pregnancy is successfully implanting or not. So, if there is a low level of progesterone, which happens when the ovulation might have happened, but it is happened in an incomplete manner. So here, the level of hormone that is necessary for an effective ovulation is probably not reached, And in this situation, your gynecologist might add a few injections to help in this ovulation. So, what is the treatment for an ovulation dysfunction? So, first of all, we have to identify what could have been the underlying cause of this ovulatory dysfunction. So, there are few things that you can do at your end, like monitoring your basal body temperature. When the ovulation is supposed to happen, there are few changes happening in your body, like you will have a raised body temperature by maybe 1 or 2 degrees. Another thing is you can monitor some changes in the secretions of your vaginal canal. So cervical mucus changes also monitor, also mirror the changes happening in your hormones or your cyclical changes. Then, if apart from this, the periods are still irregular and there are some kits available commercially which detect hormone peak, that is LH peak in your urine. So this LH peak coincides with at least 1 to 1.5 days before your supposed ovulation, which you can start taking these kits by your 10th or 11th day of your periods. So they will also indicate when your probable day of ovulation is. The most confirm and most definitive criteria to find out whether you are having an ovulation dysfunction is, however, follicular monitoring by ultrasound, which is done by your gynecologist. So this is something that you need to do. And if an ovulation dysfunction is diagnosed, then treatment of the underlying cause, if a cause is found, is the mainstay of the treatment and helping you achieve that level of hormone at the time of ovulation when ovulation is anticipated. So, this includes giving you injections for trigger, which allow your hormone levels to reach that level which is required for an ovulation to happen. So, the crux of this topic today is unless there is an effective ovulation happening, there won't be any subsequent fertility or the cycle gets infertile. So, it is very important to monitor whether ovulation is effective or not by means of some hormone tests and along with your folliculometry by ultrasound. So, this was the topic for today. May I know if there are any questions from our audiences today? So one of the questions is PCOS and ovulatory dysfunction? So PCOS is not something which is causative of ovulatory dysfunction basically. PCOS is itself in a different entity entirely. So PCOD is something where the female has more number of follicles or more number of eggs than what is required. So in this scenario, every cycle has few eggs getting recruited for forming a dominant follicle. In PCOS females, what happens is there are multiple eggs forming and competing with each other. So in this competition, the LH hormone, which is supposed to peak, which peaks only when a dominant follicle is selected, this entire process doesn't happen, and thus this is one of the causes of ovulatory dysfunction. So the treatment here would be to control PCOD to some extent so that that hormone level we are able to reach, and this would lead to ovulation in time. Even another question that we see is, can I get pregnant with ovulatory dysfunction? So, this is something very important. Ovulatory dysfunction, once diagnosed, we have to give it the right treatment of the underlying cause first, treatment of some lifestyle modifications, which will alter your stress levels, which will regulate your hormonal levels, and along with this follicular monitoring, this will definitely help in achieving a successful pregnancy. So another question is, can ovulation problems be cured? So yes, definitely. Ovulation problems like ovulatory dysfunction is something that also that can always be cured with the right diagnosis and right treatment. So if the problem is at follicular recruitment stage, then we have a set of hormone injections that can be given to a particular lady in some specific doses, which allow a dominant follicle to grow. And when there is established dominant follicle, we do give some injections which help in an effective ovulation. So ovulation problems are something that definitely can be cured. So any other questions from the audience? Okay, so this was the topic for today, ovulatory dysfunction. I hope today's talk has helped you. And in case of any fertility treatments are required on your end, you can call the below mentioned helpline to book an appointment with your fertility for your fertility checkup at Oasis Fertility. So we'll be ending this topic now. See you again in next topic very soon. Thank you.